Welcome to the continuation of the special meeting of the Arlington County Board for August 25th, 2020. And before we get to our regular items, colleagues, we're going to hear from our county manager, Mark Schwartz, with an update on our sidewalk ordinance that we passed a few weeks ago, and perhaps some recommendations or some thinking as we move ahead. Mr. Schwartz.
Thank you, Madam Chair and members of the board. Great to be with you. What I'm going to do is I'm going to share my screen and walk through some slides, which will give you an update on where we are on the physical distancing ordinance, or sidewalk ordinance as it's referred to. And here we go. Just let me know if you can see it.
Yes, we can.
Okay. So this slide here on public health concerns, I'm going to ask Dr. Varghese to walk through this slide, if you could, Ruben.
Happy to. So the primary public health concern we're trying to remind everyone about is, and I'd like to remind people, groups of people congregating increases the risk of COVID-19 virus spread. And as a reminder, the context is there is community-wide transmission of the COVID-19 virus in the Washington, D.C. area, including Arlington. People congregating at less than 6-foot distances in the same place and staying for a period of time, i.e. not just walking by, increases the risk of COVID-19 virus spread. And our Arlington Restaurant Initiative, or ARI staff, have observed groups of people congregating outside, one in the same place, 2 who have stayed there for a period of time, and 3 who did not maintain 6-foot distances outside of some establishments serving both food and drink.
Thank you, Ruben. Coming up next here, you'll see I have put up examples of the signage that will go up starting tomorrow morning. And you can see the sign on the left is the one that summarizes the provisions of the ordinance that say that you should stay at least 6 feet apart, and congregating in groups of more than 3 is prohibited, and listing the fine there. And then also we will have sidewalk markers that say staying 6 feet apart. They're called ground decals. So we have that there. I'm going to go to the next slide. I'm going to ask either Dennis Leach or Michelle Cowan, I don't know who's actually here, to quickly walk through the locations of where the signage is going to go. Dennis, Michelle?
Okay. Sorry, hi, this is Michelle Cowan from the County Manager's Office. We staff based on complaint data filed via our online social distancing reporting and complaint tool, compiled data that supported the installation of signs in the areas noted in red on this map. So you can see that it's along Wilson Boulevard in Clarendon, and then also along North 10th Street on the other end of Clarendon. And as Mark mentioned, these signs along with decals will be installed starting tomorrow. And then additionally, we will be, as our data keeps coming in and as we work with our partners in the community and across the county, we'll have further phases that will be implemented in the coming weeks as well.
Thank you, Michelle. Those further phases would include, for example, in Crystal City. So what I'm going to do is I want to turn it over to Corporal Masturis from the police department, who's going to walk us through some slides here that talk a little bit about the education campaign and what we've witnessed over the last few weekends. Jim, over to you.
Thank you, sir. What we've seen, we've passed out these educational flyers, which are very similar to the signage that will be going up tomorrow. We've placed that at all the restaurants. We've expanded some TOSAs in the areas, and we've dropped off cones to act as markers for the lines. Some places have improved, some places haven't. We've seen some, frankly, they just don't know it's an ordinance. So we're working on increasing the messaging, but also to let them know that this is now this is against the ordinance. So you can't be standing together in groups of more than 3. So, and you can see some of these pictures that demonstrates the TOSA that was put in, or the area blocking off the parking lane, and you can see the difference in the lines before and after. So we're hoping that is going to continue, but it requires constant monitoring. We have seen quite a bit of defiance and hostility towards the security towards the security staff and officers. We're just being flat out ignored. So we're trying our best to keep the lines apart and keep people separated as they need to be. We're going to continue this collaboration with the businesses and the ARI partners, and we'll continue our efforts heading into the weekend.
Thank you very much. So moving on to a related issue, the current situation in our partners in the DMV, the region we live in, which is that the District of Columbia has stopped selling alcohol after midnight on a daily basis. And in Montgomery County, they have taken the step to forbid alcohol service at restaurants after 10 o'clock. So one of the things that Office of Stores just talked about is we have begun very diligent, especially over the last few weeks, an education campaign to try to bring people into compliance. And we have noticed, and I'm going to ask Jim Masturis just briefly to talk a little bit. You talked a little bit about some of the defiance and confrontation and hostility, but the change you have seen between the hours of 10 p.m. and 2 a.m., if you could just talk about that briefly, Jim.
Sure. Just over the past few weeks, we have seen an influx of patrons into the Clarendon area. We're seeing also down on 23rd Street as well. So, our areas are as populated, and of course, with the executive order in place that limits the capacities. So I think it's obviously adding to some of these very long lines that you're seeing in front of establishments.
Okay, and then I would like if Dr. Varghese, if you could talk a little bit about this slide, and then I just had some concluding remarks after this.
Sure. This is a slide of the new cases of COVID-19 by week since the beginning of the pandemic in our area. And it's by symptom onset, and each line represents the age group or age range that we're focused on here. So let me first of all make sure people are oriented to this. On the x-axis, or the horizontal line, is the over time. So you see the months listed, and the numbers above the months and next to the months are actually the week number that we're referencing here, just so that you're not too confused. And then on the y-axis, or the vertical axis, is the number of cases, and based on symptom onset for that week. And then when you look at the black boxes in the diagram, you see phase 0, phase 1, phase 2, and phase 3 are the phases of reopening or closure according to the governor's orders. So what you're seeing here is the purple line is the line for those under 18, and it's just to remind everyone, even people under 18 have actually been affected here in Arlington. Those in red are those 18 to 29. Those that are in green is 30 to 39. Those in gold are 40 to 64 years of age, and those in the light blue are 65 and older. And if you look at this, the initial phase, you saw both the those over 65 and those who were 40 to 64 were the people who initially had the largest peak, first starting in April and then May. You saw a subsequent rise in those who are 30 to 39 years old, and then those who are 18 to 29, and those who are also less than 18 by May, and you see those numbers coming down. When you get to phase 1, which is when the governor allowed reopening of the state, and we had delayed reopening, this was the phase where groups 10 and under were allowed to congregate. The the trend lines all continue to go down. At phase 2, which started mid-June, that was when groups of 50 and under were allowed to congregate, and the trend lines continue to go down. When you look at phase 3, which started on July 1st, a few days before the 4th of July, you start seeing a rise in all the groups, but especially in those who were 18 to 29 and those who were 30 to 39, as well as the 40 to 64-year-old group. And this was when congregation of 250 people or less was allowed. And as I've reminded on previous town halls, while correlation does not imply causation, causation is hard to have without correlation. And so, as I had mentioned earlier, congregation without 6-foot distances during a pandemic leads to germ spread. That concludes my remarks.
Okay, so thank you, Dr. Varghese. Where I wanted to end up was, I think that I wanted to let the public know that we've taken some time in rolling out the sidewalk ordinance that the board adopted a few weeks ago. And we are now serious about this. We're going to start enforcement this weekend. I will tell you that I remain deeply frustrated over what I'm seeing in the community, and it is really, my frustration is not necessarily with the owners of restaurants. My frustration is with the behavior of patrons, and we will give it our best effort. It's a very manpower intensive. Given what we face right now with open defiance on the part of people standing outside these restaurants, I will probably be back to you quite quickly if we do not see what it is we hope to see with some type of proposal of some kind that might mimic what's going on in Montgomery County and the District of Columbia. And I just, I don't want to sound overly dramatic about it, but this is not a game. We're dealing with the public's health, and that is our #1 priority. And I know we've heard a lot of people in the community throwing up what I consider to be red herrings about we're going to ticket people who are standing at stoplights. We're going to, we're going to ruin life as we know it. What it is we need to stop the spread of this disease. And it's incumbent upon me and our public health staff, and I think incumbent upon the community to do whatever it is we have to do to make our best efforts. So that concludes my presentation. Happy to take any questions at this point.
Thank you very much, Mr. Schwartz. Colleagues, questions for our staff? Mr. DeFranti, I see your hand up.
Yeah, I thank you, Madam Chair. So I'd first like to start by thanking Officer Misteris and the work that the Arlington Restaurant Initiative has done. This is a very different context to be building on that work, but it does not strike me as easy what we're seeking to do, and a big thank you to you. Also, to the manager, I wanted to appreciate you bringing this forward. I'd like to just go back to the Montgomery County DC slide, if there's a way that we can pull that up. So on this slide, I guess this would be to perhaps the manager or Officer Misteris, probably Officer Misteris. It's regarding the last week and what we've seen. Concerned, have you seen an uptick in patronage over the past, last weekend? Because that's one of the concerning items. There's our efforts that we made in passing the ordinance with respect to sidewalks 2 or 3 weeks ago, but wanted just to understand if we're seeing an uptick, want to avoid Arlington getting more individuals congregating in large groups, because we know that is a risk factor for COVID-19.
So I can't say specifically whether we have increased numbers in Clarendon or not. That is something that we actually work very hard with the owners to provide incoming door counts, and that's something we do a couple times a year that has been disrupted by COVID. So that being said, it appeared, I mean, just being out and about over the last 3 weeks, Friday and Saturday seemed like they were a fair amount of people. I couldn't provide a true estimate, perhaps a few thousand people over our nightlife areas. But again, that would be simply a guess, and I can't provide any legitimate information on that because I don't know what the incoming door counts are that is usually shared with us.
Sure. Well, I appreciate your care, and I do hope folks will go to our COVID-19 website, and on the bottom left is a place to report if you're seeing problems with social distancing, and we'll certainly be looking at that. I agree that rigorousness on data is important. I think anecdotally, it feels to me, and my impressions as I've gotten emails, is that we're seeing an uptick, and that's what leads me to appreciate the manager bringing this forward. So the only other question I have, and I can share, wait for later, it's a very quick question regarding the map, and it has to do with down near, there's one area that's on Wilson Boulevard that is, so down near the lot, there's the 10th Street red line. A couple of the emails I've gotten and one of the short videos that someone sent to me of concern was along the other corner, down closer to where Northside Social is. And I wanted to see if any of staff have a concern or thoughts on that. It's a fairly narrow sidewalk, but I wondered if there was thinking as to that short half block or block. Going up Wilson, I think it is, or Clarendon. And I guess the question might be for our transportation staff, or maybe, so that'd be Mr. Dennis Leach or Michelle Cowan, or perhaps the Officer Misteris, if you have any insights as to sort of holding off on that half block, or is really the line mostly along 10th Street there?
I can tell you what we've seen from the staff at the lot. They actually have dedicated security, and we've worked quite diligently with the staff there and the managers to move their line east rather than west towards Wilson. So they're directed to have their line start at the gate where they come in on 10th Street, and it's supposed to wrap around to Irving. And actually, they were provided cones from DES to block off parking lanes as they saw fit. We had the signage put up as well. So we were using the cones to block off the parking lane to give people a little bit more room to space out. Mm-hmm. And, that seems to be working. They actually, they've had at least 2 people just monitoring the lines out front on 10th. But as things, continue to evolve, I mean, it's just an ever-changing dynamic, because you're not dealing with the same people at any given time. You have turnover as people come in and come out. So you have to acclimate them to all these new set of rules. And as you could see on the picture there along the fence, they put the educational signage that we provided them literally everywhere. So I'm hoping that the decals that go down onto the ground are going to be right in line with those or close to them, so that people not only see it on the ground, but see the posters on the fence and the poles. Great,
thanks. It's that's a lot of detail and a lot of work. Also, the 2 individuals out front is great. So thank you. Those are my questions.
Thank you. Mr. Dorsey.
Thank you, Madam Chair. A question and then a comment for Dr. Varghese. Do we have any data which looks at asymptomatic spread among various age groups in Arlington? I've followed some of this looking at national data. Do we have a sense of what's happening in our own, not necessarily Arlington, but within the national capital region?
So Thank you for the question, Mr. Dorsey. We do have a sense of what's going on in Arlington, Northern Virginia, and in the region. We make the conclusion of community-wide spread based on the fact that as we interview people in the region, including in Arlington, when we talk to cases, we try to identify, is there a known source of infection? And the vast majority of the people do not have that. So it's when we cannot find consistently known sources, the presumption is, first of all, we make the conclusion it's community-wide, and that it is more than likely that it's the asymptomatic contact, or the contact with people who are infected and don't know it, is the reason. In normal circumstances, we can usually find the source. So for those of the listening audience may not, hopefully they remember when the unfortunate church in Georgetown in Washington, D.C., that was when this started. In a sense, we were able to connect a lot of the people we identified to that. And so that was a known source of it. One day, hopefully, we'll go back to that. But until that happens, when we say community-wide transmission, that's a proxy for the fact that there's a lot of unknown contact that's happening, and that's really based on our local data. We still have not been able to find every single or the majority of the sources of those cases. I hope that helps.
No, it does. And I think it's just important in establishing why we're doing this. We have the ability for people to spread this virus who may not know that they're sick. And if they're going to be congregating with lots of other people who, based on their age and the way the virus presents itself, may also contract and be able to transmit, but not know that they're sick, this creates a mushrooming exponential growth in risk probability, quite frankly. So that's why we're doing this. And I just like to applaud everyone for bringing their particular skills to allowing us to roll this out in the most surgical of ways to start, to try and figure out where we've had identified observable problems. We try a process to correct those issues, but that we're fully prepared if it doesn't work to do something that will work. But, rest assured, what will work in all likelihood is probably going to be the bluntest of instruments that are going to, probably capture folks who are not causing any issues or who are not a part of any systemic problem. So I think I want to just echo, at least from my perspective, the plaintive call of our manager, that this is really up to people to recognize their role in making sure that our community can stay safe and that we don't necessarily jeopardize the ability for people to engage in activity safely and healthily. And that really is by people doing their part. And when they're in public, on our streets, maintaining that physical distancing, wearing face coverings, and remembering your particular role in how you might be perpetuating the spread of COVID-19.
Thank you, Mr. Dorsey. I think, Mr. Carantonis, I think your hand was up next.
Thank you, Madam Chair. I echo the comments of Mr. Referendum, Mr. Dorsey. I want to add one question. So what's the status of compliance with with social distancing and the governor's ordinance, executive order, inside the establishments right now in Arlington?
So for that, I'm going to ask Ruben to start out with, and maybe have Candace Wooden, who went out, and turn it over to Jim Misturis, who was also on the team. Ruben?
Okay, so thank you. Overall, as you all know, we have the primary responsibility for inspecting restaurants in Virginia, both by our local ordinance and what the Virginia Department of Health under the state food code. And we have an environmental health inspection team, and Candace Wooden is our senior environmental health specialist, who both standardizes our inspectors and also participates in the Arlington Restaurant Initiative. Fortunately, with their education efforts, they've seen more and more compliance inside the facility. But as you also know, the governor's orders have, because of we're trying to increase social distancing physically by limiting the number of people who are inside, it's going to create even reduced capacity inside. And I was going to turn it over to Candace Wooden to comment about the specific findings over the last several weeks. In general, kind of like what we've seen as the causes and how compliant the facilities are without, of course, naming the facilities. Candace?
Thank you, Dr. Harvey. Yes, so over the period of 3 days, the last 3 days, Thursday, August the 21st through Saturday, August the 23rd, we did observe one violation of imminent health hazard in a facility. It was pertaining to patrons sitting at the bar. The violation was corrected immediately. And then when we visited the establishment later that night, there was substantial compliance, so we did not observe any additional violations. So out of the 8 facilities that we visited over the 3-day period, we only cited one violation that was corrected immediately.
Thank you. I have an additional question that is about the right-of-way, the public right-of-way now. So there are certain sidewalks that are, larger, and we have seen at least one, I believe it was in front of the lot, that was enhanced with cones, etc. There are also on Wilson, for example, at the corner where Whitlow's is, there is a parking lane. Is there any thinking about spacing out or creating additional space so that compliance is easier for people who will be waiting in line there?
So for that, I'm going to actually put up the slide here. And Michelle, if you can, or Officer Masturis, explain what's being displayed on this slide, the before and after.
Thank you, sir. Yeah, the bottom picture that you see on the left, that's before the bollards and the roadblocks were used, that they're typically being used for right-of-way TOSAs. We asked that they use the same tools to block off the parking lane. So you can see the whole parking lane in front in the 2800 block of Wilson is now sectioned off, and it's only affecting that business. Same for the 3100 block of Wilson Boulevard. All the businesses now have a little bit more space outside, because there aren't tables out there past, say, 10 o'clock. So it provides a little bit more room, especially if they're going to get a little more creative on how they're going to space them out and use some of the stanchions. So like Whitlow's, for instance, you saw in the 2800 block, was using a stanchion system and try to space out their people, and are actually having security out there telling them and constantly reminding them. But it's a slow go. This isn't going to happen overnight, but we have to make sure we give them all the tools that they need. So.
Okay, thank you. My only comment on top of that is that, as we've seen from week 26 onwards, week 27 was the week when phase 3 kicked in. The numbers, unfortunately, are going up constantly and persistently. So this actually, I believe, is the last chance we can give this this ordinance to work. After that, as Mr. Dorsey mentioned, as Mr. DeFerranti and the county manager also insinuated, we will need to see what works and what doesn't, and go for these things that really work for public health, because this is the ultimate goal here. Thank you for your efforts and for your attention to this.
Thank you, Mr. Carantonis. Ms. Crystal, you've been waiting patiently.
Thank you, Madam Chair. I wanted to actually briefly go into the science of why this ordinance does not apply to pedestrians or cyclists or anyone passing an area. Our manager mentioned that we'd heard that concern from folks. I think it has been in earnest from some quarters and folks who have misunderstood this ordinance. And I know many continue to be disappointed that we have not prioritized street closures during the pandemic. But I want to be clear, and I think it's worth taking a minute perhaps to ask Dr. Varghese to explicate exactly why it wouldn't make public health sense for us to be trying to target pedestrians, cyclists, or anyone passing one of these zones. So, Dr. Varghese, can you just tell us a little more about why it's a problem to have people congregating, as we know the governor's order prohibits, and why it wouldn't be a problem to have people passing one another?
Absolutely. Thanks for the question, Ms. Crystal. So the real issue is it's not just the physical distance at one point in time that's within 6 feet, because the likelihood of transmission while it's there is much lower. It's also it's a factor of the time spent, and the basic thing that we've learned from public health in general over the years, not just with COVID, is time is one of the important factors that you're spending in close proximity for someone with this sort of, that transmissibility. And so using maybe some negative logic or working backwards, the CDC defines a close contact to a case, someone who actually has the illness, as being within 6 feet of that person for 15 minutes or more. And so in many ways, now that's a rule of thumb. It's possible that it's at 10, it's possible it's at 20, depending on the circumstance. But the incidental contact, that's not considered to be a tremendous risk at all in this respect. So we are using that sort of science of general public health and what we've learned also about COVID that has reinforced that this is the recommendation we give to the entire public. And that's why passing is going to be fine on those sidewalks. It's staying put and lingering and staying in contact. And one last point, even if they're wearing face coverings, the definition for close contact doesn't matter if you're wearing a face covering, because the risk at that point is really about the physical space. And that's why we've been emphasizing in public health, if you have to choose, it's actually preventing the social contact rather than face covering. If I have to emphasize one thing, staying at home and the physical distancing, they're really essentially the same thing. Staying at home is a form of physical distancing. You're keeping yourself in your own home's bubble, if that helps.
Thank you so much, Dr. Varghese. I think it's helpful to remind ourselves of the science, but I also think that that's worth stating because it emphasizes not just that it's not our intent or this is written in such a way that we could be enforcing people passing by. It doesn't make public health sense, right? And so that's truly not the point. And I really appreciated Officer Mastouris sharing with us some of the ways in which you have worked and DES has worked with the restaurants to provide more space. So it's not about crowding anybody into a narrow sidewalk because there's not areas for them to spread out. The area has been created in the narrow places where this applies, and it really is a matter of compliance and a matter of these bar patrons or restaurant patrons in particular being part of the solution. And I don't want to belabor that point. I think my colleagues have all said it well. Our manager has said it well. But I would note amid many calls to close the bars, it's worth noting that we don't really have bars in Arlington. We have restaurants. And so any attempt to close this class is going to sweep up a great number of small entrepreneurs whose businesses are barely hanging on. And I think that's a big part of the reason, or I know that's part of the reason I have been reticent. And I think that's really led a lot of us to be reticent to take blunter measures. But we also know that this is a community that's seeing its numbers increase. And we know as long as those numbers are increasing, core and important functions of our society, like work, like kids going to school, are not going to be able to restart. And so we are asking for partnership. We are asking people to be respectful to their neighbors, for those who may be coming into Arlington, to be respectful of the people who do live here, certainly to be respectful of our police. The examples of the physical disrespect that we've heard on our officers is not acceptable. And we hope very much that this more narrowly tailored ordinance can help alleviate the problem, it cannot be done without the partnership of these restaurant goers, and we hope to not have to take blunter measures.
Thank you, Ms. Crystal. Corporal Mastores, you've mentioned the issue of door counts, and I think we do that usually twice a year, and with COVID and everything going on, that's kind of fallen by the wayside. How hard is it to do door counts? I'm guessing the answer is it can't happen this weekend, but it seems like it would be really good to get a good door count if we were able to do that. Do you want to comment on that a little bit, how hard that is to enact and get that happening?
Sure, and this is solely through the cooperation of the owners. I mean, that's not something that they're required to give. It's only because of the trust that we've built up that they're willing to share those numbers. And that gives us a general sense of what's going on in any of our nightlife areas. It helps us, dictate resources and how many officers need to be down there and such. So if we know how many people are down there at any given time, it can help us with our operational plan. And that's the reason, and that's how it's been used up to date. But like I said, since COVID, that's not something we've been able to keep track of. They've been frankly taxed to a point already. So I haven't asked, many of the ththings that we normally do under the ARI umbrella just haven't happened because we're dealing with the executive order and the new ordinance. So we could, if they're willing to share, the restaurant owners are willing to share again, we could get a sense of how many people came into the restaurants, and we could also start, counting how many people are waiting to get in restaurants.
Yeah, it seems to me if there's a way to see if people would do that, even if it's incomplete, but because, as you were doing your presentation, you're saying you can't really say for sure because nobody's counting how many people are there and what the increase is and how it compares to last year pre-COVID. So anything that you're able to do, I understand you can't require people and maybe it's going to be too hard, but if it's possible, I think getting some data this weekend on numbers would be helpful if that's possible to do. So thank you. And thank you for everything you're doing. I know this is hard. This was not quite what you signed up for when we got to the ARI, right? So thank you. One question, Dr. Varghese, I'd just like to talk a little bit more about that same chart that was up before. If you could put it up with the ages and the graph, and just put that up one more time.
I think I'm asking our manager to put that up unless you'd like me to. Okay.
There we go.
All right.
Thank you. And yeah, so I think when you talked about this, which was very helpful, I'm not sure I heard you, but I might have been, not attending, and because I already know it. The shaded area, that's really incomplete data. So anybody sort of looking at this right now say, oh, look, the numbers are going down, we're going to be fine. But that's not how you should read it, correct?
Correct. So absolutely a very good point to point out to people. So if you look at the weeks labeled 30 and 31, previously those they were in those weeks actually where weeks 33 and 34 were, just to help people understand. And then as we got the data, there's a lag in the reporting of the laboratory reports and the doctor's reports. So over time, the areas that were 30, 31, 32 look like 32, 33, and 34 on this graph. It looks like it's suddenly going down, but that's an artifact of the fact that lab reports and things are delayed, and it can actually be delayed for up to 4 weeks. And so this is just one metric. We've been seeing emergency room visits also going up for COVID-like illness. You look at the overall picture, and this has not been going in the right way, and that's why I am imploring people, keep at home as much as possible. Just because we opened up, that the governor did that, does not mean we've returned to normal. So going to the grocery store should not be a daily event if you can help it. Make it once a week, make it twice a week. Staying at home is still the better option. And as Ms. Crystal also talked about, if we do these things, we can then hopefully be able to reopen things like schools, where we can then hopefully get the education in person. But it's going to take a concerted effort for us to give up some of the things we were able to do before COVID. I need to remind people, I've heard it said, well, you know, these things were things we normally did before COVID. I would love to go back there, but we've got to remember, what we did before COVID isn't necessarily going to serve us well in the time when we do have COVID, because interactions like this allow for germ transmission. And even if you're not the one who's going to have serious illness or death, there are people in our community and in our lives that have that concern.
Thank you, Dr. Varghese. And I keep thinking when we show that chart, we really maybe ought to cut off the things on the right, because I think it's so misleading to people who don't look at these charts every day, don't look at it closely. They're just kind of looking at the trend. And I think, it's not up on the screen right now, but it's so clear. We were going down, we were getting to a really good place where maybe we could have opened schools, moved into phase 3, and suddenly we're heading back up again. And that's why we're having this discussion. And Mr. Schwartz, I'm going to turn it back over to you, see if you have any concluding remarks, but I appreciate your continuing to look at this, the seriousness with which you take it, and from what we're hearing from Officer Mastoris and others, the sidewalk ordinance we're going to try, but it just is quite likely not to be sufficient, and then we're going to have to try to do something more. And as Ms. Crystal said, I don't want to catch up the folks that are with the food either, that are just trying to struggle and get by and are not part of the problem. But these large groups of people gathering till late night hours just is not, I don't think, sustainable if we're going to stay healthy. So thank you so much. I know so much work has gone into this. We keep trying to figure this out. This is innovation, not the kind that I had anticipated when I talked about it in January. And it is bumpy and difficult, but I appreciate everybody just being persistent, really working this through. Mr. Schwartz, did you have any concluding remarks that you wanted to make on this tonight?
The only thing I would add is that, from March until the end of August, everyone clearly is fatigued about this. And I just, I'm going to encourage people that, it's very frustrating to be where we are at, but it's going to require our personal efforts to do it. If you're looking to the county government to solve the pandemic, we can only do so with your assistance. So that's really all I had to add. Thank you, Madam Chair.
Thank you very much, Mr. Schwartz. All right. I think this brings us to our regular hearing items for tonight, and I'll just make a few remarks. I think we've got some people here speaking, so I'm just going to go through the tips for public speakers, some of whom haven't done it this way before. So if you are attending tonight and wanting to speak in the meeting, please keep your phones and devices muted until you're called on to speak. And just so you know, the moderator can mute you, but they cannot unmute you. And as anybody's watched our meetings for a while, we ourselves have trouble with unmuting. But if you're calling in by phone, you press *6 to unmute yourself. And if you're using a computer or a browser or an app, if you're using a computer, click the microphone button on the toolbar to make sure that the little X thing goes off and you can be heard. Just so you know, board members, we're only going to be able to hear people. We can't see you. I'm sorry. I think you're able to see us, but please do, when you talk, if you're watching on TV to watch us, please turn off the sound, so that there's not this whole echo thing going on. So turn off the sound to any other device except the one that you're speaking into when you speak. And then finally, please listen for the beep to indicate that your speaking time has expired. And then after speaking, you can exit the call, hang up, but you can continue, of course, to participate watching this on the live stream online at arlingtonva.us. or the cable channels, Comcast 25 and 1085, or Verizon Fios 39 and 40. And with that, Madam Clerk, please call the first agenda item. And I don't know what's happening elsewhere, but the heavens are opening up here at my house. I hope the power stays on. Madam Clerk.
Hearing item number 1, license to occupy between JBGS Courthouse 2 LLC as licensor and the County Board of Arlington County, Virginia as licensee for approximately 2,571 square feet of interior space located at 2200 Clarendon Boulevard and additional exterior space located at 2100 and 2200 Clarendon Boulevard.
Thank you. Mr. Schwartz, I'll turn it over to you for the staff presentation.
Thank you, Madam Chair. Making the presentation this evening is George May, assisted by Uri Arkin, and we also have some special visitors. We have Gretchen Reinmeyer here, who's our Registrar of Voters, and then I think Carla de la Pava, our treasurer, is here, but I'll turn it over to Mr. May.
Thank you, Mr. Schwartz. I will put up the presentation and we can proceed. And I trust this is up now.
Not yet.
Okay, I'll try it again.
Yeah.
Is it there?
Unfortunately, it is not.
Okay, I'll give it one more shot.
Okay.
I'm ready to come to the rescue, George, if you're stuck.
Same here, Mr. May. Either way.
Kendra,
can you, I think you have it, if you could put it up, because I'm having no success.
All right.
Oops. Sorry.
No, you're trying to do a lot of different things. Thank you.
There it is. All right.
Okay, there we go. Thank you.
Okay. As Mr. Schwartz said, I'm George May from DES in Facilities and Engineering. I'll present the basis for the manager's request for approval of the license. And the license will provide us spaces for physical distancing between the early voters and the in-person taxpayers coming to courthouse. So the number 2, Kendra. The license will, what slide number 2 presumably shows you, is we'll have a space for early voting in the former Wells Fargo space in the 2200 Clarendon building for the early voting for the interval that's listed there. And we'll also have the use of the overhangs area in front of the south entrance of Bosman for early, for in-person tax payments during this time period when these two activities overlap. Okay, number 3, please. Okay. This is the layout, how folks will be able to enter the Wells Fargo space. They have the opportunity to queue under the overhang space where you see the double row of dotted red lines and enter into the Wells Fargo space for the early voting. There's a table just before the entrance, the one in purple, where folks can do an initial check-in. And then next slide, Kendra. So folks will enter the door from the plaza area and go to both the green table for check-in and the yellow tables to receive their ballots, and then enter the area to the right where you see the 2 squares which represent the voting stations. There's one area of 2-way traffic into the voting area and back out. There'll be a partition to help separate folks before they exit to the Clarendon door and finish their voting. And this slide, please, Kendra. You can raise that a little bit higher, please. Okay. For the in-person tax payments, the treasurer will have additional tables in the overhang in front of the ATM at the south door to the lobby. This can accommodate overflow, so we don't need to bring as many people into the lobby. If you follow the green arrows, they'll come through the lobby to the tables, make their tax payments, and go out the door onto the Clarendon side of the Bosman building. So that summarizes the basis for the requested license. Uri Arkin is here if you have any questions about the terms of the license.
Thank you very much. And I don't know, we have our treasurer with us today too. I don't know. I know both of the next two items are both connected. I don't know. I want to invite our treasurer if she would like to say anything either as part of the presentation, and then we'll get to questions. And actually, we'll see if we have any speakers as well. Ms. DePava.
Hi, Libby, and all of the board. Thanks for inviting me today. Our goal is to just make sure that people stay as safe as possible while trying to pay their taxes. We have a lot of different ways to pay taxes. You can mail them in. We have drop boxes. You can pay online, and a lot of people are using those options. But there are still people who want to pay in person, and we are trying to make sure that that is done as safely as possible, not only for our taxpayers and our staff, but for everybody that's in the building. I will also mention that we're trying something new this year. We are going to open in the Thomas Jefferson Community Center for 1 week for in-person payments. And we're gonna be there between September 21st and the 25th. We're sending out postcards to notify people that live in that district and for people that came in person last year. We want to make sure that everybody has and understands all the options that are available to them.
Thank you. Thank you very much, Ms. DePava. I really am pleased the way you've kind of worked this through. And our general registrar is here. I know the next issue, Ms. Reinemeier, is more referring to what you're handling and all about voting. If there's anything you'd like to say here, I welcome you to make some comments. But if not, that's fine, and I know we'll hear from you soon. Ms. Reinemeier.
Yes, thank you so much, Madam Chair. I can save my comments to the next agenda item, but our goal with securing the lease on the space was to allow for social distancing and voting and allow for a line outside of a building to help reduce any transmission during the pandemic that we are in. So we'll talk more about that with the next item.
Thank you so much. That's great. It's just wonderful the way you all have been working together, and I know DES has been helping out as well. Our Department of Environmental Services has been helping out, Mr. May and everybody, so thank you. Ms. Jacobs, do we have any speakers for this item?
Madam Chair, no, not for this item. We do have a few for the next.
Thank you. That's great. Colleagues, questions for our staff or comments? I see Mr. DeFranti's got his hand up, so Matt, I'll take you first.
Thank you, Madam Chair. I just wanted to, I appreciate everybody who spoke, and I actually am so enthusiastic that I'm ready to make the motion unless we have another member who would like to do that.
The chair would be pleased to entertain a motion.
Okay, I move the county manager's recommendation that we approve the license attached to the staff report to occupy between JBGS Courthouse 1 LLC, a Delaware limited liability company, as licensor, and the County Board of Arlington County, Virginia, as licensee for approximately 2,571 square feet of interior space located at 2200 Clarendon Boulevard and additional exterior space located at 2100 and 2200 Clarendon Boulevard, Arlington, Virginia. In addition, authorize the Real Estate Bureau Chief, Department of Environmental Services, or his designee to execute the license to occupy and any related documents on behalf of the county board, subject to approval as to form by the county attorney.
Second.
Thank you. It's been moved and seconded. Mr. DeFranti, would you like to speak to your motion?
Sure, I can be brief. This is an opportunity to make it safer and easier to vote. And it's an opportunity to make it safer and easier to pay your taxes. And so in that sense, it's, as you kind of indicated, not innovation that we had thought we would have gotten to in January, but this is a good way of solving and addressing problems so that folks can vote early and because of the new Virginia law without needing an excuse as in past years, and also vote safely, as well as Ms. DePava's efforts to make sure everyone's safe and paying taxes. Thanks.
Thank you. Mr. Dorsey, I see your hand up.
Thank you, Madam Chair. This is a question for our attorney, Mr. McIsaac. So initially, I was somewhat concerned that this is a license agreement as opposed to a lease. But by reading of the license agreement, it looks like one that's pretty favorable to us. It looks like the only reason we can be kicked out of the space, speaking about the site known as the well site, is for non-payment of rent. But otherwise, we're protected in being able to occupy this without the landlord determining or deciding that they would like to do something else with that space. It looks like we're protected from that possibility. Is that correct?
Mr. Dorsey, in short, I would say yes.
Great. So just want to be clear as we're lauding this very wonderful innovation that's going to allow us to safely expand our voting opportunities, that it's also not going to be taken away from us due to the whims of the landlord. Great. Thank you.
Thank you. Certainly not in the middle of voting. Yes. Any other questions, colleagues? I don't think so. I think this is fairly simple. All right. Again, thank you, everybody. I love the cooperation. I love the innovation. It's wonderful to see our treasurer here. Thank you, Ms. Dellapava, for joining us. I will call for a vote. All in favor of the motion before us, please say aye. And I'll start with Mr. DeFerranti.
Aye.
Mr. Dorsey.
Aye.
Mr. Carantonis.
Aye.
Ms. Crystal.
Aye.
Ms. Garvey. Aye. Motion passes 5-0. That's great. Thank you all very, very much. I think we can make things a little bit easier and safer for everybody, and that's great. Thank you. Madam Clerk, next item.
Hearing item number 2, approval of an ordinance authorizing voting satellite offices for absentee ballots.
All right. Thank you. Mr. Schwartz, back over to you.
Yeah, well, I'm going to turn it over to Ms. Reinemeyer to make the presentation. Gretchen?
Thank you so much. Just bear with me right quick while I share my screen. So can everybody see my screen?
I can.
Okay, excellent. So just to provide a quick background, there was a new law passed this session that says that the county board must establish by ordinance any satellite voting offices 60 days before a general election. So that is why we are here tonight, is so that we can establish by ordinance these early voting locations or satellite absentee voting locations. With our electoral board and the county board staff, we have proposed 5 voting locations. This chart just gives you a brief example of why we are proposing to add locations this year. As you can see, every presidential election, we see a surge in voters interested in voting in person early before election. And this trend will continue this election for obvious reasons, but also because, as County Board Member DeFerranti said, that the law changes that now allow all voters in Virginia to cast their vote early before Election Day. They no longer need a valid reason as they have needed in years past. So the 5 locations that were advertised for this ordinance are the 2200 Clarendon Boulevard site that was just discussed, Madison Community Center up in North Arlington, the Walter Reed Community Center down here off Columbia Pike, the Aurora Hills Senior Center Community Center down in the Pentagon Crystal City area, and then the Langston Brown Community Center over here closer to the west end of Arlington. There's a few changes from 2012 and 2016. So we have run additional voting locations in the last 2 presidential elections. The changes that we are pursuing are moving from the 2100 Clarendon Boulevard location to the 2200. And that is just because that space is larger than the meeting rooms available in the 2100 Clarendon Boulevard. And because of the increased desire for social distancing, our goal is to keep all of the voters and all of our staff safe while they come to vote in person. And then we are proposing 2 new locations because of the law changes that are expanding early voting options to all voters in Virginia. And these 2 new locations are the Aurora Hills Senior Center and the Langston Brown Community Center. The reason these locations were chosen is because we've seen extremely long lines on election day down in the Crystal City and Pentagon City area. So we're hoping an early voting site down there will alleviate election day lines. And then we see our highest rates of election day voters in our western precincts of Dominion Hills and Overly Knolls. So we're hoping an early voting center closer to them might reduce the number of people voting on election day at those locations as well. And with that, that is my presentation. So
thank you very much. We'll take some speakers. I believe you have some members of the Electoral Board with you here tonight. Do you want to introduce them?
Yes, we have two members of the Electoral Board here tonight. We have our Secretary of the Electoral Board, Scott McGearing, and then we have our Vice Chairman of the Electoral Board, Matt Weinstein.
Wonderful. Thank you. Welcome, everybody. It's great to have you here, and perhaps there'll be some questions for you as well when we get to the discussion. Right now, I think, Madam Clerk, you said we had some speakers for tonight on this item.
Yes, that is correct. Let me share my screen.
Okay.
Okay, our first speaker is Joan Porte, followed by Michael Cheekham.
All right.
Thank you very much. I'm Joan Port, President of the League of Women Voters of Arlington, and I appreciate this opportunity, Madam Chair and members of the board. As you know, the League of Women Voters has a long history of supporting free and fair access to the polls, and in this very unusual year, this has never been more important. We support what the General Registrar just said about the locations. I'm not going to repeat them because she just did. If the budget allows and an additional site is encouraged, we would hope that would be placed in the Green Valley area if you so chose. These additional satellite areas need to be open at the very least from October 17th to the 31st, 2 p.m. to 7 p.m. weekdays, 9 a.m. to 5 p.m. Saturdays. We would also support Sunday openings if it were in the budget, since that is a very common practice in many early voting states, which we now are. Also, new conditions affecting the delivery of the mail of the U.S. Postal Service are making it essential to set up a procedure for the hand delivery of mail ballots. We are very encouraged by the progress being made at the special session of the General Assembly regarding drop sites at the satellite locations. Voters must be able to deposit their ballots safely and with confidence that they will arrive on time and be counted. Dropping off their absentee ballots is a fast and easy way to do this. It is also imperative that a clear, concise informational chain is given to voters regarding how and where they can either vote or return these ballots within the rules of the law. It has come to our attention through the outreach that we have been doing that there's a great deal of confusion about this. For instance, we learned that one senior home was hoping to bundle all of the residents' ballots and send them via overnight carrier, unaware of the laws prohibiting ballot harvesting. So we urge the creation of these quick, clear, and concise rules for the people. And as always, the League stands ready to assist in all phases of this work, including the dissemination of this information in our usual nonpartisan fashion. And we thank you for this opportunity.
Thank you very much, Ms. Port. We really appreciate the work of the League, and it's probably more crucial this election than ever. Thank you. Our next speaker
is Michael Cheekham, followed by our final speaker, Marsha Johnston.
Hello, this is Michael. Thank you for this opportunity to speak. Really quickly, so one of the things, I think it's very important that all voters in Arlington County are aware of all the options that they have in terms of sending their ballots. And the other thing I'm very concerned about is the safety and health of those working in these satellite locations prior to Election Day, as well as those working on Election Day. We should make sure we do every measure we can possible to ensure their safety and health. And then I guess it would be very, very nice to know that the county and the Commonwealth to clearly state what will happen to all the ballots, whether they are mailed in, whether they're scanned and emailed, whether they're faxed, whether they're people go in early voting in person. I mean, I'd be curious to know myself because I plan to just scan and email it. But if that does not count as quickly as if I were to go in person, then that would be a factor in my decision. And that's the end of my comments. Thank you.
Thank you. We'll have Ms. Reinemeyer answer. I'm not sure scanning and emailing is possible, so we'll get to you. Next speaker, please.
Our next speaker is Marsha Johnston, final speaker as well.
Unmuting. Thank you. Board, thank you, Madam Chair. Just, it's not really speaking, it's just questions. So these are for Gretchen and yourselves, depending on who's qualified. I suppose I'm with the Arlington Democrats, chair of voter support, which involves voter registration and early voting poll greeting, which we do with sample ballots for the Democrats. So I would just was trying to reconfirm the hours for early voting. I think I've already gotten that, at least for the 2200 location, although I was wondering whether it would be, if there would be 3 days in the last week until 7 p.m. or if that was going to be longer. It seems like Gretchen may have mentioned that, but I wanted to confirm that, whether it would be the same as in previous years. And then also the satellite locations, Joan mentioned hours. If that's what I had too. If that's correct, that's great. One thing we were wondering is if there will be reserved parking for curbside voting and if the vote from your car curbside service will be available at 2200. That's another question. Will there be the voter guides sent to registered voters in September, and will it include a vote by mail application? Again, these are just things we're kind of wanting to confirm for our own outreach that we're doing, continuing to do. And should ballots be returned to 2200 or 2100, first floor or third floor? And will the satellite locations all have drop boxes? It sounds like they will. Will there be others? That's another question. And also, would there be any shuttle service for seniors coming to early vote, given that some of the early voting sites are predominantly senior centers? That was a question from some of our senior outreach leaders. So I hope I have them all written down if anybody needs them, but those are the questions I have.
That's just great. Thank you. And that's our final speaker?
That is correct, Madam Chair.
All right. Colleagues, if you will indulge me, I thought maybe I would ask Ms. Reinemeyer to answer the questions that she's gotten, and then we'll take questions from you all. Is that fair? Does that work for everybody? I think so. Nobody's complained. Ms. Reinemeyer, would you like to address the questions that came up? I think maybe the first one is about taking a screenshot and emailing your ballot. I believe that's not allowed in Virginia, but please let me know.
Yes, you are correct, Madam Chair. If we mail you a ballot, it must be returned via the mail or in person. We do not accept electronic transmission of ballots back to us. That is not permitted. We do, in some cases, email ballots to military and overseas voters, but that is a very small pool of voters in Arlington County that are eligible for that type of ballot.
And they can't return it that way, right?
No, they still have to mail it back to us using diplomatic pouch or commercial carrier services such as DHL or one of those. But yeah, there's no electronic transmission of ballots back to our office.
Right. Thank you. That's important. And then the hours, do you want to confirm? But I assume it's up on our website for anybody to see. That we're going to be prominently displayed in places.
Yeah, so the hours, tonight's meeting is about choosing locations. The hours is the second step. So we have not confirmed hours and location or hours beyond. We will be opening the 2200 location at.
Just a second. Could everybody mute themselves if you're not Ms. Reinemeyer, if that's okay? All right. Thank you. Go ahead, Ms. Reinemeyer.
So we will be opening the 2200 location on September 18th, and it will be open Monday through Friday, 8 to 5, with extended hours those last 2 weeks. So the goal is to have it open to 7 p.m. actually 4 nights a week to match what we would be doing at the satellite locations or the early voting locations. But the hours will be confirmed later this week once we work with the park schedules to get these locations.
And those will get up on the website, and we will.
Yes, absolutely.
Thank you. There were questions of, will there be voter guides available?
Yes, so we are working with the communications department for Arlington County to distribute a voter guide. These would be distributed to voters, but also available for voters to pick up should it not arrive in their mailbox. And in this voter guide, it'll have information on the vote by mail process, how to request a mail ballot, including an application. It'll have the early voting locations, a map of the locations and the hours of these locations, in addition to instructions for our voters to make their plan. So they need to make their plan to vote. Are they going to vote by mail earlier on election day? In addition to some other information about election security and how you can trust the ballot and what the process looks like on our end. So
that's great.
Yeah.
Madam Chair, could I jump in with a very quick question on that subject? Could you, Ms. Rademacher, could you repeat again, or perhaps you didn't share it, when that voter guide would be available?
It will be available in September. We don't have an exact date yet because we're still, as Joan mentioned, we are waiting on the General Assembly to finalize some laws for us this week. So once we know what we can put in the guide, then we will start working on getting it out to our voters. But this should be well in advance of the election. So.
All right, thank you, colleagues. Excuse me for sort of hogging here.
Yeah.
Swallowed a nut the wrong way. Where do people return ballots?
That's a good question. So drop boxes is one of those things that is currently being discussed in the General Assembly this week. So my intention is to have these early voting locations serve as drop locations should the General Assembly allow that to happen. And that was passed by the Senate, so it is moving its way through the General Assembly as we speak. So.
Thank you. Shuttle service.
Shuttle service. We do not provide rides to polling locations. We usually we refer voters to the parties because they will provide rides to polling locations, but this is not something we have done in the past.
Thank you. One more question, and then I'll go to Mr. Dorsey for a motion. What is going to happen to all these ballots?
So that is a good question. So ballot security is obviously our top concern, and making sure every eligible voter has a right to vote, but that they only get to vote once. And so there's been a lot of questions about mail ballots. If I request a ballot, does that mean I'm locked into voting my mail ballot? Things like can I change my mind, or what happens to my mail ballot, or how are you keeping me from voting twice? And essentially, before we can send you a mail ballot, we have to confirm that you're a registered voter. And then that puts a hold on a note in your record that we have issued you a ballot. Before we can issue you another ballot, you would need to confirm that you either lost that first ballot that we sent you or return it, indicating that you are not choosing to vote it. But once you return that marked ballot, there's a hard stop on your record where we would not count another ballot for you. We would not issue you a second ballot, because we know that we had already issued you and counted a ballot for you. It is a complicated process, and we will be working with our communications team to put out some videos around this, both when we get ready to launch early voting and when we get ready to start processing ballots for mail out and on return. So,
thank you. Mr. Dorsey's requested to make the motion, so I'll call on him to make the motion if you're ready now, and then Ms. Crystal's got her hand up, but Mr. Dorsey might like to speak to his motion. Mr. Dorsey.
Sure. Thank you, Madam Chair. So I'd like to move that the county board approve the attached ordinance that's attached to board report number 2, dated August 21st, 2020, to provide for voting satellite offices for absentee ballots and early voting at the following locations: 2200 Clarendon Boulevard, and at the Aurora Hills, Langston Brown, Madison, Walter Reed community centers, for a total of 5 locations in all, 4 community centers and 1 commercial office building.
There's a second. I see, Katie. I'm reading your lips. All right, it's been seconded by Ms. Crystal. Thank you very much. Mr. Dorsey, anything you would like to say to speak to your motion?
Sure. I think this is not controversial, but I do want to ask a couple of questions just to get at how we arrived at the recommendations for the spaces that have been requested. I assume, Ms. Reinemeyer, that there's some opportunism involved in choosing these, what's available and what's cost effective and what meets within the plan. Can you tell us a little bit more about how you, in your professional judgment, might think about policy for satellite voting locations for future elections, recognizing that we're under a time crunch for this year, but for future elections, how should we as the board think about allocating resources to provide for something that meets your desires for this kind of a program?
So what we knew that we would be going to no excuse absentee voting or early voting a year ago. And what we did in our office is we met with our colleagues both in Maryland and DC because they've had early voting for more than a year. And what we've learned is that it does take about a decade for a jurisdiction to settle into early voting sites. And so this is going to be a long process where we might add locations or remove locations as it becomes more popular with voters and we see where people tend to go. So as how we arrived to these locations, obviously we are guests in the parks facilities when we are at these locations. So historically where we have gone to have been what parks is designated as underutilized facilities. So it might be where we aren't competing with heavily used facilities. Initially in 2012, we were at the Barcroft Sport and Fitness Center, but that was a heavily used facility. So we had to relocate the following presidential to the Walter Reed Community Center, where they had slightly more meeting rooms that were available to us. And that is why some locations were not considered, is because they are not acceptable for our needs, or they're a heavily utilized facility that couldn't accommodate us in a secure room for 2 full weeks.
Thank you. I think that's just really important as we consider, I'm sure all of us, looking at the map of where these locations are and where we know voters are and where we think there's a population density. We could probably identify locations that may fit better on a map, but it's helpful to know that there are lots of different levels of criteria. And I guess paradoxically somewhat, some of the best locations are in some of the least trafficked areas. So we do have to consider, I think, colleagues, what our role is in making available places and facilities in places that might meet some higher density thresholds. Thank you.
Thank you. Mr. DeFranti, you've been waiting.
Jump off mute. So a couple of questions. One about Sundays. Of course, there's been national coverage of pews to the polls and the effort to make sure we expand access to voting. At this time, of course, faith is being practiced in a whole different way because of COVID-19. So many churches are not full and watching remotely. Did you consider this, Sundays, and seeing if for a couple of Sundays, the last 2 Sundays, outreach to specific locations to make sure that there's full access to voting could happen?
So I'll be honest, Sundays are not in the consideration at this point in time. And this is because, once again, we're looking at the data in DC and Maryland. And DC does not open on Sundays. Maryland does open on Sundays. And the numbers don't always justify the cost that it takes to open those locations. So because we are a small office with only 7 permanent employees running 5 locations for essentially 15 straight days, puts a real strain on a staff that's already been burdened with 3 other elections this year. So that is definitely a concern of mine, and the consideration for Sundays is how do we do that in a way that doesn't tax the staff that we have in place right now. So,
got it. Okay. I think there's there's also the concept of induced demand and in transportation. So certainly for me, that the likelihood that many churches aren't full right now, it seems a relevant fact on that question, but certainly one that down the road I could see an interest in, and mindful that 7 is just a few. The only other specific question I had was, did you as far as access, Walter Reed, I know, has been used in the past. Did you consider the Career Center? It's a little closer to Columbia Pike, and I know there's construction there, so I just didn't know if you had thought about that.
The Career Center has been considered in the past. The problem is that it's not the most accessible facility right now because there are 3 steps down into that main area after you enter the location. And once again, we need to be in a secure room inside these facilities. So it's obviously a lot of these facilities are closed right now, so that could expand our uses into them. Unfortunately, when we started planning these locations more than a year ago, these facilities were not on the table because they were in use by schools and other aid departments. So.
Great, thanks. I might have other questions, but I'll yield the floor for now.
Mr. Carantonis has been waiting. I have to make one small comment, though. I think our backgrounds are showing, because I believe there are religions that don't meet on Sundays but do on Saturdays, and probably other days as well. Just thought and I know you know that, Mr. DeFerranti. Mr. Carantonis.
And Fridays, yeah, they are. So, Ms. Randemeyer, first of all, I should preface that with a deep, deep gratitude to your office and to you personally for being one of the absolutely highest performing registrar's office and leading of electoral boards in the Commonwealth. I think that you have been doing exceptional work, not only right now but also the years leading to this. I want to follow Mr. Dorsey's thinking about how we choose these locations. And you probably know, and it's not a secret, that I've been personally, quite passionate about going to places based on the criteria of what is the voter participation. You actually approximated that when you said, in Aurora Highlands and Langston Brown, we had issues there with, a little bit longer lines and higher demand. So for me, for example, the Arlington Mill area, this is a place that's really walkable distance. And right now, COVID is really walkable distance. Walkable distance is really important for almost 13,200. Voters, registered voters. So this is a critical part of our population. It's also one of the most diverse parts in Arlington, where voter participation in all cycles, but especially in off-cycle elections, has been lagging behind the average. So this would be a criteria for me in my book to look at this location more closely. I understand that the center is right now used as a testing location, but fortunately, in my opinion at least, the lowest level of the center that it's actually used for COVID testing is really separated from the upper level, for the second level, so that I could imagine that a location of a early voting station would, polling place would be possible. As a footnote as well, there are 2 places in Arlington County that I personally think that are not optimally covered. One is east of Richmond Highway, where we've seen a significant increase in population. It's also quite dense. And I remember myself seeing the queues in the polling places there. And the second is actually down Fairlington. So I'm just throwing that on the table. But Arlington Mill for me is one of the locations that I'm especially passionate about, because until recently, until before COVID, we could count on voters to jump on a bus and go 10 minutes, 10 minutes ride and a short walk to Walter Reed. This was possible. Today, this is not easy to ask voters to do. So this is why I'm asking you.
So the way, and this is where we would ask the attorneys, the way the ordinance is drafted, I believe that we can subtract from the locations in the advertised ordinance, but it would be difficult to add locations at this point in time. In terms of Arlington Mill specifically, it was evaluated as a site after it was recently constructed in 2016. And we were unable, it's extremely important that these early early voting locations be in a ground floor location. It's one of the reasons, even in this building, we move from the 3rd floor to the 1st floor when we get busy, because the line just becomes unmanageable when you have an elevator. And so we would need to be in a ground floor location in the Arlington Mill facility. And I honestly have not been there in several months, but I do not believe there's a secure room in the ground floor location that is available to us. It was discussed, but with the COVID testing there, it just was not possible to accommodate it for this election.
Okay. Just saying that the 2nd floor is also ground floor there from Dinwiddie Street. Yeah. It also has 2 entrances, one main entrance, which may be sometimes conflicting with the COVID testing side, but there's also side entrance that's, close to the alley that separates the building to the Arlington Mill apartments next to it. Mm-hmm. They are both ADA compliant, and there is a youth and teen entertainment room that, in my, amateur eyes would qualify as a secure room. Yeah. So I just encourage you to look at this again. And I understand the legal problem right now to add an additional location, but if it's possible, I would greatly advocate for that, even if it was as a drop-off site, or as a drop site, or as a last week, site. That would be very, very appreciated.
Thank you. I may have had one more question, but Ms. Crystal, go ahead. You're muted.
You're muted.
I was unmuted and then I muted myself. All right. Thank you so much for the presentation and for the hard work that's gone into finding these sites that are appropriate. And, I think what's really exciting about this opportunity and this vote that we're about to take is that it's all about expanding the ability of Arlingtonians to vote. I had originally had a question about the Dropbox locations and how we're preparing for that should it become the law of the Commonwealth, and really appreciated the comments that you made about that. Looking forward to that voter guide, because I think the message that's really going to carry to the people of Arlington is that voting is easy, is convenient. You have a number of options that are safe and reliable. So I just wanted to kind of make a note, I suppose, for the record, while we're having this conversation. I was so heartened by what Ms. Reinemeyer noted about these take time, right? The locations that we have, the sites we have, are set over, as long as a decade, and they will evolve. It strikes me that the location or the criterion that I would most want is actually the one that we least want during COVID, which is to say a place where a bunch of people are going already. And so I'd love to see Arlington Mill be that site in the future. But when I think now not only about the COVID testing, but about Project Family that's continuing there, or about Aspire, which we hope is going to be part of the solution for a lot of families who don't have options for daytime childcare for their kids with schools closed. That's a crowded site, right, to bring a lot more people in. I hope, this time, by this time, election year 2021, that site is not only a lively hub, but a safe hub for people to be in contact with one another and to have the opportunity to vote. I love Ms. Johnston's suggestion, too, about a location in Green Valley, the opportunity to pursue a Drew Elementary School or similar for early voting, too. So I think we have a lot of opportunities ahead to think afresh about this, and again, just to note that I hope we will get to a point where the places that are have the most people or the biggest hubs of community life are not the least desirable places because of the difficulties of social distancing, but the most desirable because it makes voting even more convenient and easy and safe for Arlingtonians.
Thank you. Mr. DeFranti, did you have another question?
Mr. Dorsey, next.
Actually, I don't see his hand, though. Mr. Dorsey, did you have a question? There the hands are. All right. Sorry, Mike. Who knows what's going on? Christian.
So, thank you, Madam Chair. Yeah, I'd just like to say Ms. Reinemeyer, you explained very well. Colleagues, I think we're really going to have to tackle this issue big time, because as much as Arlington Mill meets geographically and in terms of people who attend the facility, a great sweet spot, the real issue here is what Ms. Reinemeyer outlined. We need to be able to essentially displace something from that bustling place for a period of time, because the location for voting needs to be exclusively for that for a period of time so that it can be a secure process, which we all endeavor. So we've really got a kind of conundrum when we think about community facilities that are in great locations that are not heavily used, because they don't really exist. Ones that are in great locations are heavily used, and that presents a problem unless we overbuild capacity or find some way of displacing something else that is, serving a vital constituency. So I don't want to understate, how difficult this task will be. So I think we just need to prioritize working with the registrar to kind of figure this out in future years, because she has needs and we have priorities, and I think it's not going to be easy to mold the two, but we have to work at it. With that said, I had one other comment. Just Ms. Reinemeyer, I just want to say, as someone who, my first involvement as a sort of county employee came under the auspices of your department as a poll worker, as an election worker. And I can just say that Arlingtonians should have incredible confidence that this election will be handled not only professionally, competently, without any room for fraud. The processes and procedures that you have in place and the diligence with which...
Mr. Dorsey, you just froze, I think.
Your Honor has noted the envy of many registrars' offices in the Commonwealth, but really our community should be comforted in knowing that their votes will be secure. And I am thrilled that we have so many more opportunities for people to vote. And even if all the locations aren't in the right place, when you add in that people can essentially do mail-in voting through the absentee mechanism, we are making it possible for everyone to participate. And now it's up to people who want folks to vote to do their advocacy to make sure that they do. Thank you.
Thank you. Mr. DeFranti.
Thank you, Madam Chair. So I just want to echo, we've had a phenomenal registrar's office for years, and Ms. Reinemeyer, you're continuing that.
Thank you.
I wouldn't want to be in your shoes to follow an outstanding registrar and then try and meet that standard. But a big thank you. I want to ask a little bit about the drop boxes, because I think all five of us likely support the idea of drop boxes, stamps to mail, which is another component of the Richmond legislation, and the opportunity to cure mail ballots, which we saw in the Washington Post 2 days ago, and all of us who voted via mail, it's not completely simple if you haven't done it before. So, so can the drop boxes be at locations that are not the five, is the question.
So that is one of those questions up to the General Assembly, is we would need to advertise those locations. I don't believe we'll need to do it through an ordinance like we do at these early voting locations, but we would need to have drop locations established prior to, I believe it's 55 days before the election, the way the legislation is currently written. And 55 days is September 8th. So basically Labor Day. Yeah.
Great. So just count me as one who would put Arlington Mill and Drew as at the absolute top of the list for those Dropbox locations. And then I will note that it's, from an equity standpoint, I think it's just access is critical. And so I do think legally we're 69 days, and this is going to give you, I'm not trying to give you a lot of challenge, but I think that, I'm still interested in seeing if Drew and Arlington Mill could be possible even for a week or a couple of days, because I know that security, I'm mindful of the 7 of you that are working so hard, but given what's happening nationally, access to voting for our Latinx and African American communities, and those 2 locations have a large percentage, is important, and it's more important in this election than I think it's ever been. So, is there any possibility for a couple of days, or is that feasible or not logistically?
I would confer with the county attorney. My understanding of the new legislation is that prior to the ordinance passing, the locations had to be published for 2 weeks in a newspaper. And so 69 days does not give us the 2 weeks time to advertise additional locations in the newspaper, unfortunately.
And is that correct, Mr. McIsaac? Are we stuck?
Yes, I'm afraid Ms. Rennemeyer is absolutely correct. You have a window that's approaching rapidly, and you do not have time to advertise any further changes to the ordinance.
And that's the case even as we're in a public health emergency, I guess.
Yeah.
Yeah, well, I did think about the possibility of adopting new locations on an emergency basis, but you would be forced to re-adopt them within 60 days, which would mean you're essentially adopting them within the prohibited 60-day window. So that is not a potential solution.
Great. I think, Mr. Carantonis, I've just about run this into the ground. I'm trying. I hope this is fuel for drop boxes at those 2 locations, because there is actually, I've done Open Door Monday from a secure room that's tucked to the side of that sort of teenage area. So thank you, Madam Chair, for letting me run this one down.
That's all right. Thank you.
And just as a comment, we always take away functions normal. You know, our community centers are in high demand under normal circumstances, so we always take functions away. I mean, that's just how it works, and elections come first in that sense.
Yeah.
I had I think if my colleagues are done, I had a question, Ms. Reinemeider, on the I guess you call it curing the ballot. So
yes,
during the special, you and I corresponded a little bit, and there were apparently a lot of people who made errors and didn't get to vote because they did. Could you talk about that and what kind of backstops we have to try to help people out? Because it's a lot more confusing to do it this way.
Yeah, so this is one of those things that is in front of the General Assembly this week, and I am optimistic that it will get passed. But essentially what happens is the way the law defines casting your ballot now is that once a voter drops their mail ballot in a mailbox or delivers it in person, it is deemed cast. And so once you cast your ballot, you cannot change your mind. You cannot correct it. So what we saw in the special election, especially because of the confusion about the primary, you did not need a witness signature, but for the special election, you did need a witness signature, is we did end up rejecting about 1% of our ballots on election day because they did not complete the envelope adequately. And a majority of that was because they lacked a witness signature. So a lot has happened in the last 5 days. As Joan would be happy to report, the witness requirement is no longer in place for this November's election as of last Friday. And that's as a result of a legal challenge brought by the League of Women Voters. But what the General Assembly is trying to do now is to allow voters to cure their ballot. So when they return their ballot, as we're opening it, if we see a deficiency on the envelope, we would contact the voter and allow them to either, we would reissue them a ballot or allow them to come to our office and cure whatever issue was on the envelope. So either they forgot to sign it, they listed the wrong address. Those are the main reasons that we would not accept somebody's ballot. So does that make sense?
Yeah. Oh, absolutely. And you'll put that, will that kind of information be in the voter guide? Are you able to get that?
Absolutely. Yeah, absolutely. And as well as we are redesigning, the State Board of Elections recently approved a redesign of the envelopes. So we're hoping the redesign will make it a little bit clearer about what voters should fill out in their statement of voter, so that we will see lower rejection rates just because of a better redesign.
That's great. Thank you. Well, I won't take the time to echo all of the praise and plaudits. My heavens, what a year. But I will ask you, Ms. Reinemeider, when did you begin as our general registrar? How long have you been doing this?
Yes, I started July 1st, 2019. So I have just a year underneath my belt. So.
You picked quite a time.
I did, yes. So.
Yes. absolutely did. Yep. And I've seen some notice that maybe there's a 55-day rule that's being changed. We'll see what the General Assembly comes up with.
Well, yeah, what I think by September 1st, we should have most of the information locked in place. And so that's what we've been instructing our voters is by September 1st, voters will be able to make their plan with the best information available. So.
Great. Well, thank you very much for everything you're doing, all your flexibility, and I'm surprised you still think you seem to be doing okay. I cannot imagine trying to take on this task. Thank you. This is just absolutely crazy. Thank you. Anything else comments before I think we're ready to vote, colleagues? All right. All in favor of the motion before us, please say aye. Ms. Crystal. Yeah, you're muted, but I saw you say aye. Mr. DeFerranti.
Aye.
Mr. Dorsey.
Aye.
Mr. Carantonis.
Aye.
Ms. Garvey. Aye. Motion passes 5-0. Thank you so much, Ms. Reinemeyer, and everybody, all the work that's gone into this. We are a few more days, a few more months to go. We are getting close. We are getting close. Thank you much. All right. I believe, Madam Clerk, we're ready for our next item.
Yes, we have one additional item, which is an emergency allocations for food and rent assistance.
Thank you. Mr. Schwartz, I think I'm back to you for a presentation.
Thank you, Madam Chair. This evening, I'm going to ask Anita Friedman, assisted by Brooke Hammond-Perez, to walk through a summary of where we are and what additional resources we need for rent and food assistance. So over to you, Anita.
Thank you, Mr. Schwartz. Thank you, members of the County Board. I'm back with my colleague, Brooke Hammond-Perez, as promised, to update you on the current situation of food assistance and needs for eviction prevention funding for the community. I'm going to pull up some slides as I talk. Let's see, hopefully this will work. There we go. No.
Yeah, well.
Is there something up?
Yeah, except it's your applications and links.
That's not the right one.
You're getting close.
Hold on 1 second. What is that? Hold on. Let me do this again. Although probably Brooke has it and Kendra probably has it too. This is the one I'm trying to get up. Okay. Can you see that?
You got it. And it even looks like the right one.
Okay. So we'll talk about food assistance first, and then we'll talk about eviction prevention funding. And excuse my dogs barking in the background. Between February and May of 2020, Arlington County saw an 84% increase in SNAP applications. I presented this to you the last time we spoke, but now it has data all the way through August, the first week of August. So you can see that we're basically hovering around double the amount of case applications that we had prior to COVID, although we're down from the peak that occurred in April. In addition, we have had a 23% increase in unduplicated number of households served by AFAC. These are the numbers. That's also from February to May. These are the numbers where we are now. AFAC is pretty much serving similar numbers to where they were in the beginning of the crisis, about 2,400 households per week. And of course, our home delivered meals has increased also through Meals on Wheels. Food insecurity is a continuing reality. This shows you basically, hold on a second, from February to July, unduplicated clients and households. So we reached a peak of about 9,000 individuals or 3,500 households back in May, and now we're just about at the 3,000 mark of households. The issue is that food insecurity is an ongoing problem, and in a recent report from the National Capital Area Food Bank, we expect there still to be food insecurity across the Washington, D.C. region, and perhaps a growing food insecurity. The Cooperative for Hunger-Free Arlington has done an amazing job being instrumental in addressing these immediate needs. However, moving forward, after discussions with Abby Raphael, Diane Kresh, Charlie Meng, myself, and Leslie Peterson from schools, we do believe that we need to have more backbone strength within our county government in order to address food insecurity as a basic need in our community. Similar to the way we staff our rental assistance with staff, we need to have a stronger bench strength for dealing with the issues of food insecurity. So part of today's request for additional assistance, which the county manager is presenting, is to establish a new food security coordinator position in the Department of Human Services, and to establish, and that would be basically have the following tasks of maintaining the updated data inventory of the food resources in Arlington, providing the regular communication to internal and external audiences about the food assistance, identifying ongoing food insecurity needs and providing solutions, and coordinating a coalition of stakeholders. We don't know how formal that will be, or what we want to call it, a task force or a coalition. The name is not really important. It's that we want to have on an ongoing basis a convening of all of the actors and stakeholders involved in the community who are providing ongoing food resources to the community, so that we can make sure for the long term we're looking at food insecurity and providing solutions. That's one part, so that we're requesting an FTE to be allocated to the Department of Human Services to serve in that role for the future. The second thing I wanted to mention is that AFAC openly and transparently says that they provide supplemental food assistance. And as you can see, they're now providing as many as 2,400 to 3,000 households per week. Nonetheless, there are still some households that do not access AFAC, whether it be for reasons of transportation or not feeling comfortable going to the distribution sites, whether it's not being their choice of food. We do find that there are households who do better by receiving a form of gift card in order to purchase groceries. So we did there was a pilot that was undertaken through APA and AHC, funded by the Arlington Community Foundation, where they were each given $25,000 to see how did it work? How did people respond to the gift cards? And the results were very positive in that people could actually take the gift card to the local store, buy the groceries they need, and then cook the kinds of meals that are more desirable for their household, nutritious-wise or culturally significant. We would like to expand that and create a pilot where we would be providing grocery gift cards to 500 families for a period of 6 months at a cost of $200 per family per month, about $50 worth of groceries a week. The total cost is $400,000 to potentially be also supplemented by another $200,000 by the Arlington Community Foundation. And this would be distributed through a coordinated group of nonprofits who call themselves LINK, but actually who they are 4 key community healthcare providers: the Arlington Free Clinic, the Arlington Pediatric Center, the Virginia Hospital Center Outpatient Clinic, and our own Department of Human Services Maternal and Child Health Clinic. Now, how did these four end up being together? Well, they've always worked together on community health. However, as part of an outgrowth of our Destination 2027 work, Dr. Varghese worked with these providers and applied for funding to the Northern Virginia Health Foundation to start looking at the correlation of social determinants of health with the patients that came to the clinics, to see what kinds of ongoing social issues these families are facing. And they have continued collecting data that indicates that a significant portion of their clients who come for health reasons also are still experiencing food insecurity. So they, through the lead of Arlington Free Clinic, approached our department to be the implementer of a grocery gift card program, specifically to the clients who are already accessing the services of the healthcare providers. So the joint food assistance action request for the county board is to authorize 1 FTE for the Department of Human Services to be the food coordinator for the county. And the second is to authorize the $400,000 out of, and Mr. Schwartz can correct me, a combination of coronavirus relief funds and the county manager's contingency budget to fund the gift card program for a total of $482,000. Mr. Schwartz, should I continue, or is there any?
Well, you shouldn't continue asking for money, but if you have anything else you want to present.
How could? I mean, I wanted to know if I should stop for any kind of discussion. No, yeah. So I go into the.
Great time for questions.
Okay.
Yeah. No, I think that's fine. Let me see if colleagues have got some questions. I'm going to pop out of the box real quick with one, and then we'll get started. On AFAC, you know, the issue is I understand it, AFAC, while they are wonderful and right, that they're meant to be supplementary. They don't provide all of the food, right?
That's correct.
Yeah, and that's got to be an issue for some of our families now. Thank you. All right. Let's see. I think Mr. DeFranti, I think this gives me the order in which the hands went up. I think Mr. DeFranti, you are first. You have a question for staff, and I think
Sure.
we've got more of a presentation. Is that correct? Because you asked to pause.
Sure. It sounds like a motion would be in order, and then we could do discussion if that's the chair's preference.
Yeah, I'm going to try and check. Ms. Friedman, I think you're not quite through your presentation yet. Is that correct?
Okay.
Well, I have a second part that's eviction prevention. Would you like me to finish that first before you all discuss, or you want to just discuss food and then move on to eviction prevention?
I do have a question specifically about the food assistance.
Okay.
Yeah, go ahead. We'll take food.
We'll take food first.
I'll come back to you for a motion, but I think we'll get through the whole presentation first. Ms. Crystal.
Great. Thanks so much, Madam Chair. And Ms. Freeman, thank you very much for the presentation. I think this really resonates with a lot of us who are maybe involved with nonprofits, right, and see this opportunity for people to be able to select their own food is particularly empowering, especially at such a stressful time. The question I have is, you had described, for example, some of the tensions in people seeking services because they're concerned, especially after the public charge rule, or otherwise kind of being accountable, right, for having access services. And yet, on the other hand, with CARES relief money, we have to be able to provide documentation. Yeah. So can you talk a little bit about how that tension is playing out here, since this is a mix of funds? Are we going to be able to give these to folks without having to formally take down their information and household data?
Well, these households are already known typically to the healthcare provider. So when they come in to see a healthcare provider, they are asked about other aspects of their life, including their food insecurity, their housing, their other needs. So we will obtain information about them as individuals, not, of course, about their citizenship, but we will be asking them to, their qualifying criteria will be basically that they're about 100% at the federal, at income at or below 100% of the federal poverty level, which is what these 4 providers typically see.
Okay, so these folks are they've already been means tested for some programs. So so this may not be reaching the people who are afraid to get help.
Well, it's interesting that the healthcare providers, because of the dire need of the lowest income and typically those who are uninsured because they're undocumented, right, and they can't access Medicaid, rely on these healthcare providers, the Arlington Free Clinic and Pediatric Center, and the outpatient clinic and the maternity clinic for their health care. So they already, that's their sort of trusted health provider. And so they typically fall at the very lowest income levels because they can't access any of the benefits that documented individuals would be able to. Does that answer your question?
To some extent. So I guess the question I have is, and Mark, you want to weigh in? Mark, I don't know if you understood my question better before I try to reframe it.
Okay, sorry.
No, that was very informative.
I think the way Anita phrased it was intentional. We're saying that the money will be drawn from either the CARES Act or the county manager's contingent or the coronavirus relief funds. Let me give you an example, which is that under the CARES Act, if one of the recipients of the gift card went and purchased something that was questioned, let me say I'm see if I can come up with an example. Let's say they went to a grocery store, not that they would do this, but purchase a magazine, for example, then we could run into a passel of trouble with the auditors on that. So, and that's not necessarily our goal. So we want to provide the flexibility. That's why the money may end up getting switched out. And so for right now, you should feel comfortable that nobody will go without because of that. But we're going to need to work through each of them on potentially a case-by-case basis.
Okay, that's really helpful. And so the blending of funds then empowers us to say to these healthcare provider partners, please tell your patients they need not end up, afoul of public charge rules. That information doesn't have to be collected and shared because there's also local money.
Correct.
Really helpful. Thank you.
Yeah, and I think Mr. McIsaac is making sure we craft the motion to make that work. Thank you. Let's see, Mr. Carantonis.
Thank you, Ms. Friedman. I appreciate all the effort that you're putting in this, your department and everybody else. So I have just a practical question. I'm very encouraged to support the debit or value card approach for families. I really expect this to be a very good experiment and show that this is the right way to deal with this problem. I just want to make sure that, do we distinguish between a household with, let's say, 2 kids or 4 kids, or how do we account for the size of a household?
Well, all the income levels vary based on household size. So the federal poverty levels are, I think the basic is for one individual is 12,000 and some change, but for a family of 4 is 26,200. So it increases as the family size increases.
But we could have 2 eligible households, one with 2 kids, one with no kids. Would they get the same $50 card per week?
Well, it's right now we're looking at sort of, I think, tracking it at a family household of about 4 to receive the $50 per week, or $200 per month, family of 4. Now, whether or not we would then divide it by 2 to be $25 for a family of 2, I don't have that specificity, but I can get back to you. But there comes a time when there's like a diminishing return. That's part of the problem with the SNAP benefits, is that you put in the same amount and you get less and less because you're only one individual. So we want to make it fair to the size of the household, but significant enough that it makes an impact on the household's needs.
I perfectly understand. I was more worried about the larger households. So.
Oh, the larger, yeah. We may have to accommodate for that. I don't have that specificity, but I can, as we develop the specific protocols, we can definitely take that into consideration.
Yeah, one of the things that I most like about this approach is that this is in the hands of people who are healthcare providers who deal with these clients every day. They know them very well. They also can measure the outcomes in a more accurate and better and closer way. So there are a lot of improvements here. And I also see in this approach the exit strategy from the little bit spotty system that we have today of distribution in various sites that with fall weather, etc., will begin to be less feasible as we go. Thank you.
Yeah, thank you. Yeah, I think part of it too is we've had incredible volunteer efforts stepping up, but I don't think it's sustainable. And I think this is great. They've gotten us over this. We're heading into the chronic phase and need to make sure this is sustainable. So I think it's great. Yeah. Mr. DeFranti and then Mr. Dorsey.
I'm thrilled about this, and just a big thank you to the manager and Anita and Brooke, who are working nonstop. You just alluded to all the private individuals who have worked on hunger, Madam Chair, and so I also think it's worth noting that Dr. Duran, we're going to 21 sites and counting, and Dr. Duran and Leslie Peterson, I know, have been working on it, but it's great to see our superintendent leading us forward, and also our school community stepping up. That'll be, I believe, the first week in September, unless I'm incorrect, or maybe September 8th. But there's also the Community Foundation, and then Charlie Mang, and just I don't have a specific question. The job description is like wonderful to see, and it's a culmination of the leadership on the Cooperative for Hunger-Free Arlington. I will note that I did speak to one advocate who pointed out that a ton has been done on hunger, and we did start this COVID period by putting $500,000 towards AFAC, and that's so long ago that I think you can forget it. But this is phenomenal, and I'm just a big thank you to you, Anita, and to the manager for all you're doing.
Thank you. Mr. Dorsey.
Thank you, Madam Chair. And Ms. Friedman, echoing my colleagues and being very appreciative of this work, I'm curious as to how we're going to conduct an analysis and a study of the pilot. Do you have a methodology in mind? What are you hoping to discover at the conclusion of this so that it can inform the development of policies and programs in the post-COVID world?
Thank you, Mr. Dorsey, for that question. Yes, we will be doing, since part of the beauty of using these this link group is that they regularly conduct an assessment of different social determinants of health, different social indicators, housing, food stability, family stability, every time they have a contact with the client or the family. So we will definitely be recording sort of a pre-food insecurity kind of baseline before we implement the pilot, and then at different intervals during the 6 months, redo that sort of assessment and then see what kinds of progress there is on the level of stability as a result. And we will be able to get you that information.
Terrific. I look forward to that. Thank you.
Yeah, I think that's great to gather that information. Ms. Friedman, I wanted to ask you, could you talk just briefly about, I think it's called a food council. Obviously, some people are advocating we do that. I think a lot of places do that. I think we don't. Could you just talk a little bit about what that is and our thinking on it?
Right. Well, through the efforts of the Cooperative for Hunger-Free Arlington, Abby and Diane and Leslie and Charlie brought together, sort of started creating more and more contacts with different food serving entities, and where we would maybe usually stay in our lane of, government and how government intersects with nonprofits. Now we have at the table churches and the Arlington Community Corps and PTA groups and, the Abuelitas group of grandma retired teachers who are checking in on their folks. So the whole stakeholder group has broadened, and it's a whole body of work. I mean, Abby has been doing this, with Diane's assistance, but it is a continued body of work that if we really want to have good data collection and ongoing participation of this wide array of stakeholders, we need to formalize it and staff it. And so whether we call it a food council, a task force, maybe something like a Project Peace or our consortium of Continuum of Care for Homeless, the way we usually bring together stakeholders through working groups, it will look probably something like that. And depending, I've looked into places like what Montgomery County has and what Fairfax County has, and it depends how widely we want to grow, because sometimes in those different counties, they merge in other efforts like urban agriculture or childhood obesity. So I'm trying to start sort of small, but I could see how if it, stabilizes, there may be definitely overlap with other kinds of initiatives in the county.
Great, thank you. No, that's helpful, and this is a start, and we need to do it. And as I say, we're innovating all the time.
Right.
Thank you. All right, are we ready to move from hunger to eviction, colleagues? I think, and then we'll have a motion once we get the presentation complete. Is that all right?
Okay, here we go.
Okay.
I'm back to my slides.
Yep.
Can you see them?
Yes, we can.
Okay, so here we go to eviction prevention. Oh, here was the AFAC, race and ethnicity. It's just remarkable how much of the Latinx community is really food insecure. You can see that yellow line there.
Yeah.
That's compared to even blacks and whites, how high of a need there is. Okay. Oh, did I go too far? Sorry. Hold on a minute. Going back up. Going back up. Oh. Okay, so let me tell you about where we are with eviction prevention. We have spent some significant money, as you all know. The need is ongoing and pretty serious. And even with the stay of evictions through, now it's April, is it? What's our next date? That the governor, I can't even remember what the date is for. Matt, you can help me out.
You mean to end the eviction?
It's September 7th, but the governor's proposed, I think, through the end of April.
Through the end of April. Yeah.
Not there yet.
Not there yet. Okay, well, hopefully that's coming. So in FY 2020, because we've completed our fiscal year accounting, we spent basically $2.7 million in eviction assistance. And that was a combination of local, state, and CARES allocations. And they were distributed through DHS and Thrive. We provided assistance to 1,555 unduplicated clients. And an average payment was $1,001. Okay, this is through the end of June. The demographics, which I'll show you, 45% were Black, 37% white, 40% Hispanic, increase of 17% from pre-COVID. So we spent a significant amount of money, and we were lucky to access those the CARES Act dollars. And you can see here, this only goes through June. And it shows that May was, I'm sorry, this is not incomplete, that May was higher. But actually, July became our highest month, which is not on here. And we spent $776,000 in 1 month. Okay? Now, in a normal year, we spend about $800,000 of local money, and then we'll get some state money. Maybe $1 million would be a year of a lot of spending for eviction prevention. So we're at $2.7 million for 2020. This is the per household, where this unfortunately only goes through June, but I have the numbers. And hold on, let me show you some unduplicated households. Served by eviction prevention. Hold on a second. Okay, households, the demographics, the households requesting eviction prevention, largely 40 to 49, so like middle-aged customers, and then next 30 to 39-year-olds is the orange bar. That's our demographic for age, and for zip codes, to no surprise, the yellow is 22204. The next largest is 22203, that's the gray. And then gender, a lot of female-headed households, many, that's the blue compared to the male-headed households. And race, the orange represents Black and the gray represents white. Over here you can see. And then Hispanics, hold on a second, is the blue, and the non-Hispanic is the orange. Okay, so let me take this off a minute so I can talk to you and see you. Okay, and my friend Brooke Hammond Perez, my colleague, is right there, so she'll be able to chime in. But basically, when you average out the key months of spending from during the coronavirus, we have spent approximately $0.55 million, or $550,000 per month on average between April and July. Okay. When we consider how much money we have budgeted for FY 2021, and we subtract where we are now with our spending, in July we spent $776,000, we estimate that to get us through from August to December, which is 5 months, we will need an additional $1.125 million if we continue to spend the average of $550,000 per month. The county manager is supportive, and he has spoken to us about the ability to use coronavirus relief funds, and we are pretty much in need of replenishing those funds as soon as possible so that we can continue to prevent people from obtaining significant arrears. Even though they may not face eviction, they do accumulate the arrears. So, Mr. Schwartz, would you like to say what the county board action requested is, or shall I say it?
Go forth and utter.
We are requesting an allocation of $1.125 million from the COVID-19 contingent account for eviction prevention and rent assistance for FY 2021 to get us through the December 2020 at the rate of $550,000 per month to continue to prevent people from accumulating significant arrears.
Great, thank you.
Brooke, did you want to add anything, Brooke Hammond Perez?
Nope, you knocked it out of the park.
Oh, shucks.
All right.
I paid her to say that.
I should see if we have any speakers, colleague. Let me see if we have any speakers on this issue, and then we'll get to comments. I don't know if we do. Madam?
We do not.
We do not.
We do not have any.
All right, that's fine. All right. Let's see. Mr. DeFranti, do you want to go ahead and make the motion? Are you set to do that?
Sure. Happy to. Let me just get to it. I'll move that we allocate $1.125 million from the COVID-19 contingent account 101-91102 for eviction prevention and rent assistance appropriated in fiscal year 2021 from the coronavirus relief funds distributed from the Commonwealth of Virginia, and that we authorize a 1.0 permanent full-time employee in DHS Economic Independence Division and allocate $482,000 from a combination of coronavirus relief funds and the county manager's contingent for the position and the grocery gift card program.
Second.
Great.
All right, moved and seconded. Thank you. Do you want to speak to your motion?
Appreciate not only Ms. Friedman, but also Ms. Hammond-Perez, all that you've been doing. I note that in the attachment to the two-page memo, there's a reference to those who are seeking our assistance. And for me, this gets to serving those most in need, but also, unfortunately, the overrepresentation of those most in need in groups and our African American and Latinx population. So this also seems to me a critical priority given the last 6 months and the racial justice and equity that racial equity that we've been trying to work on. So I'll be supportive.
Thank you. Mr. Carantonis.
Thank you, Madam Chair, and thank you, Ms. Friedman, Ms. Hammond-Perez, and everybody who has been working on this. I have one question. What does it mean, significant arrears? I know that, and it's very clear, we have to make it everybody very clear. The significant arrears, what they cause actually, it's not only the stress and, the burden that these households are experiencing right now. It's also leading to self-evictions, and this is significant. We really want to avoid self-evictions as well, not only evictions in terms of, judicial process of people losing their homes, but also people being desperate and walking out. So what does significant arrears mean, and how will this money produce some sort of, confidence that these households can live with until the end of the year?
Well, I think and I'll ask Brooke to chime in, but I think that knowing that we have a steady stream of, a positive balance sheet for an extended period of time, then gives us the confidence to be able to say to clients in need, we will be able to support you. So that's number one. And without that, it's not always, obviously we know the goodwill and intention of the county board and the county manager, but having the sort of positive balance sheet allows one to have one's working staff speak with more confidence about the likelihood of a family who's seeking assistance to receive it. Brooke can probably tell you more details. We said there was an average payment of $1,001 to these 1,555 unduplicated households, but the households came in multiple times. And so there's, usually it's not just 1 month at a time. People come in and they typically owe several months behind. And by the time we are able to get all the paperwork together, often there's another month that's been tacked on. So, the CARES Act money, or rather the CDBG monies, had a maximum of $1,500, but we did not put a maximum on some of the local funding intentionally because the rents are very high, right? Brooke, I don't know if you have more specifics about the amounts that people request.
Yeah, I mean, that's right. We don't have a maximum on the local funding, and our rent and mortgage relief program, so RMRP funding from the state that came through, the $450,000, also allows us to pay for arrears from April 1st to date. And that is a new thing that they've changed so that we can more easily spend down that money. So that's been very helpful. And to Anita's point earlier, I think it's important. We have 23 caseworkers that are working with individuals who call in for eviction prevention assistance, and to be able to tell those clients that they're working with, we're here to help you because they're calling in and they're in a state of crisis. And so to your point, Mr. Carantonis, about, the self-eviction, people feel like they're just so underwater that they've got to get out. If we can reassure them that, we're here to help and we can help pay the arrears and the debt that's been accumulating, then I think that goes a long way.
I mean, you've shown us the statistic. One striking part of this is the women-led households.
Yeah.
So that tells me single, mothers.
Right.
This is really strong. And I know probably, or I can imagine, that they are also the most reluctant to come for help because they, for all the conditions that are surrounding these cases. So that means also that we have the burden to reach out to these households the best way we possibly can, not only to wait at the counter with a positive balance behind us to see what we can do. So, reduce red tape, make ourselves more accessible, go where they are, and use the organizations that know, just like we do with the gift cards, or I want to call them value cards. Right. All
right.
Yeah. Thank you. That was my first question.
Dorsey.
Thank you, Madam Chair. The automatic stabilizers that we have in this country when we hit downturns have long been insufficient, and the one-time stimulus has worked its way out, and there's no at least clear prospects as to whether it will return. So I want to home in on the 700,000 burn rate in July and really explore whether that's our new normal without any of these stabilizers being in effect or any other stimulus. And are we prepared if we need a supplemental appropriation to what's being requested now to get us through the end of the year? So I guess that's a combination for both Ms. Hammond-Perez and Ms. Friedman, and also you, Mr. Schwartz.
Well, I think one of the difficulties in calculating is we know the crisis has been, it seems like forever, but in reality, a duration of no more than, from March till now. So we don't even have 6 months of data practically. When we project for you folks the housing grants, we have years and years of data and reliable data about what the normal application and household income is. But this is basically, we can tell you what the lowest month was, the average, and the highest. But we won't know until next month or the next month after that how the trend is really going,
And yes, sorry, Anita. And one other thing I'd add is we are tracking the payment data weekly. So, and I'm working closely with Andrew Schneider from Arlington Thrive, so that we are looking at our kind of our burn rate in as much real time as possible, given that we're swamped with the influx of requests. So that I think if we get to the point where we come into October, November, and it's looking like we're not going to make it through December 2020 based on the $550,000 projection in this request, then we can hopefully get ahead of the curve as much as possible and request additional funds at that point in time, rather than wait until we've got $5 in the bank account and then request it, if that makes sense.
No, it does. And to the extent that that can be, I love that you're flagging that as you are, because this is likely going to indicate broader issues which may impact our food delivery, our food security program, et cetera. Sorry, Mr. Schwartz.
Yeah.
I was going to say that, and you brought up a good point, Mr. Dorsey. We'll come to the board in September with a really full summary of our financial situation. But as you know, as we've been having conversations, for example, with Arlington Public Schools, we have about $41.3 million in total CARES Act funding from the state. We've set aside about $7 million for schools. We've already spent, I know you're familiar with the examples, but we've earmarked $500,000 for schools for internet essentials. With this money, we have added beyond the original allocation we made in Thrive funds. We do have enough money, and we prioritize the basics, which are, housing and food. We do have enough money to come back and allocate additional funds for the rest of the year. We have to spend that CARES Act money by December 30th. I'm pretty confident we'll be able to. And let's not also forget that we do have this $10 million contingent we've set aside. I fear that some of that may have to go to deal with revenue shortfalls. I don't want everybody to think that somehow, therefore, that everything's A-OK and that the Congress can continue to shirk its responsibility, and they shouldn't. But we will be back to you if the spend rate. I actually anticipate the spend rate in this area and all the other areas will go up considerably, given that, as you said, the safety net has been pulled away. But I feel confident that we'll be able to meet those needs at least through the end of the year.
Thank you. Thank you.
And I'm going to take Chair's prerogative and follow up just a little bit. I think this is for you, Mr. Schwartz. As we're talking here, we talk about burn rate and going through these amounts of money and focusing on the renters. But I believe I didn't have I had a certain amount of economics. This kind of keeps everything moving. If people are in houses and they've got money to buy groceries, they buy them at the stores, and that keeps the stores going. And in fact, not paying the rent, they own buildings, they've got to, pay to keep the heat on and the air conditioning on and the clean. I mean, there's a whole economic, so that part of what we're doing is propping up. And I wonder if there's a way of putting a number or quantifying it at some point, like in September, something pointing out to people. It isn't that we're just giving away money or burning it and it's going away. It's actually keeping, I believe, our local economy kind of cooking. Yeah. Is that, I see some head nods. Mr. Schwartz is looking skeptical.
No, I mean, I was going to actually, when we're done, call Mr. Dorsey and ask him to run the analysis for me, because
yes,
we'll calculate the multiplier effect from this. We'll have a great study at the end of COVID, but give us some time to get through the pandemic first.
Okay, I will. Multiplier. That was the word. That was the money. That was the money. That was the word I was looking for. But it sure would be good to have some of that as we talk about this. It just worries me that some people listening, it's important that people understand why the federal government needs to step up, why we do this. It's to keep us all going so it all doesn't fall apart. And sometimes that gets lost, I think, in the discussion. So thank you. You're smiling, Mr. Dorsey. I look forward to that multiplier effect analysis. Thank you. All right. Next on my lineup of hands, I see Mr. DeFranti.
I think maybe Ms. Crystal is before. Do you want? Okay.
Oh, I'm sorry. I was just going down the thing. Ms. Crystal, sorry. Apologies. You're muted, Katie.
Thank you. So I really just appreciate the presentation. I think the magnitude both of the problem and the threat, and the county's unprecedented effort to keep our fellow Arlingtonians in their homes. It was really compelling as you all presented it. Mr. Carantonis described something that I think is really actually one of our biggest problems, particularly given that we now have legal services at the point of, an eviction hearing in the general district court, but this problem of self-eviction. We know that there are so many people, particularly who feel vulnerable for a variety of reasons, including immigration status, who won't even let it get to court. They'll leave and find themselves in, all kinds of dangerous situations. So we talked, I think, when you were last with us about legal services at the GDC and what you all had been doing, which, I think was tremendously effective, right? We saw that stave off a lot of evictions when the eviction court reopened. I wondered, I know in the past we've engaged with legal services providers to do tenant information sessions, sort of know your rights as a tenant. Is that continuing in a virtual manner? How are we working with community-based providers? How are we getting the word out to folks so they know that they don't have to leave just because their landlord threatens?
I wanted to say that Department of Human Services is working together right now with CPHD, with Claude Williamson and Ann Venezia, and Brooke and I have been in discussion about presenting to the board, through the county manager, of course, a more comprehensive eviction prevention strategy. So we are working on a document for you that will include also perhaps adding resources from Legal Services of Northern Virginia, and perhaps the Legal Aid Justice Center. Because as it turns out, which I wasn't aware, Legal Services of Northern Virginia does not represent undocumented clients, which was something that Brooke found out that we didn't know. But the outreach that we do is through typically to the residents through our regular networks of nonprofits, school social workers. Legal Services Northern Virginia does have some outreach capacity, but I don't think it's extensive. And other kinds of community advocates. So we don't really have, I think, sort of an outreach team dedicated to educating the tenants, except we work with Tenant Landlord Commission, and there's a lot of outreach that they do. I would have to defer to maybe someone else who knows more about CPHD's outreach to tenants. But I don't know, Brooke, do you want to add to that?
No, just that I do know that the Legal Aid Justice Center does do outreach and advocacy on these issues. Know Your Rights sessions. I believe they're still going on virtually. And to Anita's point, it's not just the undocumented residents that Legal Services of Northern Virginia is unfortunately not able to represent due to conflict of interest funding issues, but it's also the underdocumented residents, so individuals that are TPS holders as well as DACA recipients. So we're looking at some proposals, Anita and I, to possibly provide legal representation as well as the advocacy and outreach through both of these organizations, perhaps.
Thank you. I'm really glad that's something that's top of mind for you all. And I think maybe what's heartening here is that we do have partners, some that we even fund, right, to do that type of education for the undocumented, the underdocumented, the mixed status, right, whether it's Legal Aid Justice Center or Just Neighbors or others. So I'm hopeful that there will be partners who can do that same very effective work that they do educating people about their documentation rights with their housing rights as well. So I'm really pleased to hear you all are already focused on it, and we'll look forward to more updates.
Thank you. All right. I'm not sure on the order of hands now. I think it's Mr. DeFranti and then Mr. Carantonis. Does that work? Okay.
Thank you, Madam Chair. So by virtue of going last, the questions I have been ticked off by each of the colleagues, and really appreciate the estimates on the long term in your mind, the big debts, building those up and trying to address them. I wanted to ask first to thank you, because in individual cases, your team at DHS has really, you're working so hard to help individual families, and I'm just grateful as I send them along your relentless work. I really appreciate. A question on, I'm glad to hear about the governor's money being more flexible. I have heard a little bit about paperwork, and I want to see the amount of paperwork, and I want to see if you have thoughts. Certainly what you just shared about helping the under and undocumented was very helpful, but is there additional caseworker resources, or, I'm thrilled. I hope that this food person may eventually be able to take some of the weight off of you, Ms. Hammond-Perez, just additional work. But is there either caseworker additional beyond the 23 that we built up to, or like a staff person that might be able to, that would help? Is there any need there as we try to help address paperwork and all the work you're doing?
And Brooke, what you could tell, the before number and the 23 is now the after number. So
right, the before number was I can't do math. 16. So we've hired 7.
Temporary.
And they speak Mongolian, Spanish, and Amharic. So we're trying our best to also, hire caseworkers that speak the languages of the populations that are calling in. I think it's really going to depend on the numbers and if there's an increase in demand and we feel like, we're getting backed up, then, talking with Anita to determine if we need to hire additional assistance. I don't know, Anita, if you have anything you want to add.
Well, they're temporary workers, right? So, they're not receiving benefits, but and we also helped Thrive with some. They have now 3 social workers, I think, where they used to have, I think, one admin assistant who handed out checks. Now they have 3 people fielding phone calls. So we'll have to see, if it increases, we may have to add more temporary caseworkers. We also redeployed within our own department our community outreach workers and employment services specialists to answer phones. So
great. Any thoughts on that? That's super helpful. I'm mindful that asking for additional budget, we have to assess, and the manager will have thoughts, but I just am mindful of how much I feel is on both your plates. Any thoughts on the paperwork piece of things? Bugatti has helped some. I think the Thrive folks have helped some. I know your folks are working flat out. Any thoughts there?
Yes. So Heather Venner, who is the Community Assistance Bureau Chief, has been working with certain nonprofit providers like Bugatti, APA, AHC, to kind of train them on these are the documents, these are the paperwork that is required for all the different funding sources. And to be quite honest, it's a lot because depending on the funding source, like the CARES Act funding requires a lot of paperwork. The local funding, we have pared down the paperwork as much as possible so that we're really only asking for the bare bones necessities to prove that the need is there. Our MRP funding has its own set of paperwork. And so it's really trying to kind of parse out what's the funding that's available and what paperwork is going to be required. And our caseworkers have been very careful to make sure that if it's an undocumented or an underdocumented resident, that if possible, we're going to try to use the local funds so that we're not scaring them away with all of the paperwork. Although none of the different funding sources that I've referred to pose a public charge for those individuals, there's the fear factor still. And so we've been training some of the nonprofit providers to help so that when they're working with their clients, they're helping them fill out the documents and get it back to us in a more efficient manner.
Great. Well, I think you guys are working flat out. I know. I guess on the paperwork, I just hope that we would, keeping that enough pipeline and certainty of the private funding. We want to rely on the CARES and get it spent. But if our funding is less paperwork, we just don't want people to self-evict because they're dying to and I think you know that. I just wanted to sort of make that point. Thanks.
Mr. Carantonis.
Just a technical question. So basically, eviction prevention spending is the spending that tries to manage the arrears and bring the tenant to current, and then it's rental assistance kicking in, right? Correct? Do I understand it correctly? Okay.
Yes.
That for me was important because so basically the other thing that's important to me is to be able to correlate that with employment, which is I understand, an additional layer. That's maybe for the September meeting to discuss, because for me this is the most important thing, right? This is a stabilizing factor. This is what would, by the way, the worst thing for multipliers is when there is uncertainty, and that depresses the willingness of these households to participate in the economy. That's my problem.
We'd be happy to update you on employment at any time, because Ms. Harriman Perez also oversees the Arlington Employment Center, and we've been conducting virtual job fairs. With some success, I would say, right?
Yes. Very cool platforms where people go into little meeting rooms and have an interview all virtually. And we've had, I think our last job fair had over 250 participants.
Wow, it's great.
Okay.
Okay. All right. Quick question. I believe we're getting a better relationship with schools now through this pandemic, and that all of this outreach and trust and stuff, I think the schools often, teachers and they're more trusted than maybe DHS with the unfortunate acronym that you guys have got. So I just kind of wanted to, I guess, just a little assurance that is you're kind of continuing to work on that and build up that relationship, because I think that's so important. Thank you. I see the head nods. Thank you very much.
Yes.
All right. I think we're finished here. I will just say that all of this work that we're doing, thank you, Mr. Manager and Anita and Brooke and everybody and my colleagues. This is how I sleep at night. If I thought we weren't doing things to help people eat and have a roof over their heads that need it, it would just be horrible. And this just really, so if it's all about me, this really helps a lot. Thanks for doing everything we're doing to help everybody, because that's what makes this community a great place to live and serve. Thank you so very much.
Okay.
All right, colleagues, I think we're ready to vote. Yeah? All in favor of the motion before us, please say aye. Ms. Crystal.
Aye.
All right. Mr. DeFerranti.
Aye.
Mr. Dorsey.
Aye.
Mr. Carantonis.
Aye.
Ms. Garvey. Aye. Motion passes 5-0. Thank you, ladies, very, very much for all the work. Look forward to more information on the pilot. Look forward to that multiplier analysis.
Thank you.
All right.
Thank you.
Bye.
Ms. Jacobs, I believe we have nothing more to come before the board tonight. Is that correct?
Yeah, that is correct.
All right, everybody. Stay well. Take care. We are adjourned.
Thank you.